Hi everyone, I'm Brian Fulgraff with UPMC Prehospital Care, and I just wanted to take a minute or two to work through some of the alternative ways that we might take a standard pre-filled D50 and administer both the dose of D25 for pediatric patients as well as the D10 continuous maintenance infusion that we might be administering to these patients with Glycogen Storage Disease. So first, let's just start with D25 for the administration of acute hypoglycemia where serum glucose is less than 60 and the child has an alteration in mental status and the presentation of altered level of consciousness. So we think about a standard pre-filled D50. You have 25 grams of dextrose and 50 cc's of total fluid to give you the 50% concentration. Where what we're trying to achieve is 12.5 grams of dextrose and 50 cc's of fluid. And it's a relatively straightforward and easy thing to do. As we connect the pre-filled, we would note that we have 50 cc's, and what I want to do initially is just waste half of this volume. So I'm going to use the trash can here beside me, and I'm going to push this down until I have 25 cc's remaining. So now we would approximate that I have 12.5 grams of the initial 25 of glucose left in the pre-filled, and what I need to do is return the volume to the initial 50 cc's. So I'm going to connect a needle. I'm going to use a 100 bag of normal saline because it's what I had available, and I would clean the port off, and I can refill this syringe back to the initial 50 cc volume. Dispose of my sharps. So I mix this around. Now I've turned my pre-filled into a D25 solution with 12.5 grams of dextrose and 50 cc's of total volume, and I would administer that 2 cc's per kilo to this child. So assuming I have a 20 kilogram patient, I would administer 40 cc's of this volume. First, we have to be able to create the D10 solution from the equipment we have in the truck, and then use the dosing chart provided and the consult with medical command to arrive at and verify that we're administering the right dose. So what I do is I start with my 250 bag of normal saline solution and my traditional pre-filled amp of D50. For my 250 bag, I get a 60 cc syringe and a needle, and I'm going to remove 50 cc's of volume from this bag, leaving 200 cc's of fluid. And of course, during demonstration purposes, I'm taking a lapse on cleaning ports with alcohol or even taking an appropriate aseptic technique. But this is to demonstrate the process of preparation and dosing and administration, and is not meant to be 100% clinically accurate with how we would expect you to perform in the field. So once I have 200 cc's of fluid volume remaining, I have an amp of D50 that again is 25 grams of dextrose and 50 cc's of fluid. If I inject this volume back into this 200 bag, I've created a solution that's 250 cc's of total volume with 25 grams of dextrose, or an appropriate solution of D10. Now that I have my drug and my fluid volume correct, I can give it a quick shake to ensure that it's appropriately mixed. And now I'm going to collect a 60 drop infusion set as well as a dial-a-flow or flow regulator device. And this device may be somewhat new to you. You'll notice that it has some numeric scoring along the outside. This is measuring cc's per hour that the device is going to allow to pass through. In those instances where we're using a 60-drop administration set, cc's per hour and drops per minute are the same numeric value. So I'm going to connect this over, and I have my number scale on one side. If I turn it all the way to the left, it's in the off position. If I turn it all the way to the right, it's open and marked as prime. And I want to connect this to the end of my 60-drop administration set. I want to make sure that it's turned all the way over to prime. I'm going to connect my micro drip set to my D10 solution, and I'm going to prime the tubing as I normally would. Once I see that my tubing is appropriately primed, I can go ahead and set my drops per minute to the appropriate dose based on the dosing chart provided as reference. So for example, if that was 40 drops per minute, I line this dial up to the 40, and I go ahead and connect my fluid to the patient. I hang my bag up high, and as I turn this administration set on, you'll notice that the micro drip set is regulated to administer 40 drops per minute. I can dial that up and down to whatever titrated dose is appropriate for that patient. If you have any questions about this material, please feel free to contact us at Pre-Hospital Care. We're always available and happy to assist in any way we can. Thank you so much.